Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the November 9th, 2020 update from the Dubuque County Public Health Incident Management Team. Dubuque County's case total continues to soar with 908 cases in the last 7 days. Dubuque County is just about at 7,000 cases with another record amount of cases reported over the weekend. If we keep up with this pace, our days to double metric of 41 days will become reality on December 12th, and there will be almost 14,000 cases in Dubuque County by then. We are in one hot mess, and it's going to stay hot unless everyone buckles down soon. The 14-day average positivity rate now up to 23%, and the state and local hospitalizations continuing to climb are proof that we all need to do more. Did you know that hospitals are calling on staff to serve in medical and monitoring roles they don't normally do? Of course, with just-in-time training, they're still able to serve all those that need hospital care. And all of this while Iowa and the nation, particularly the Midwest, continue to surge in COVID-19 cases. Locally, the spread of the virus continues due to large group gatherings, along with smaller group gatherings and within households, especially now that indoor events are happening. Nationally, up to 50% of spread is happening in smaller group settings. I know a lot of our messaging has been to avoid large social and community gatherings and events, particularly those held indoors, and now we really need to also focus on smaller gatherings. To give you an example, an online tool developed by a collaborative of scientists at the Georgia Institute of Technology along with researchers at the Applied Bioinformatics Lab in Stanford University, presents these scenarios. In Dubuque County, if you are at an event with 100 people, there's a 99% chance at least one COVID-positive person will be in attendance. If you attend an event with 10 to 15 people, there's a 56 to 65% chance at least one person will be infected with COVID and potentially spread the virus. Those are pretty high odds for smaller groups. So this tool is a way to plan for non-essential activities, and it's available on the web. What about those essential activities like getting groceries or gas, medical care, and even work for those essential employees who cannot work from home? The key is planning ahead. When possible, schedule curbside, carry out or delivery for food and other essential items from restaurants, grocery stores, and other retailers selling the things you need. We were all doing this back in March and April. I think it's now time to resume those habits and ways of doing business, especially as we move indoors with cooler temperatures and winter approaching. Our local retailers and restaurants offer many options to avoid visiting stores in person. Sometimes, however, you may need to go in person. Pick a time when the store typically has less customers, and if the parking lot is full when you arrive, go back later. As for essential workers, wear your protective equipment, especially masks, like we all should be wearing when around others, and also keep your distance and follow workplace protocols about reporting illness and symptoms of COVID-19. If you're watching the news today, you may have heard one of the vaccine manufacturers is now releasing information about their COVID-19 vaccine efficacy, or how effective the vaccine is at preventing COVID-19 infections. Pfizer announced early results of their trials as showing their vaccine very effective in preventing COVID infection. Now these results are early, but it's promising news on the vaccine front. Other manufacturers will be sharing similar estimates as the trials continue. One thing's for sure, safety of the COVID-19 vaccine is a top priority. Public health and healthcare providers are making plans for receiving and giving their vaccine to their patients and the community. Rest assured, we will keep you informed on the vaccine front as planning moves forward. I know I continue to give a lot of not so good news, but it's reality. And everyone needs to know the severity of the situation so you can plan for the next couple of months and work to keep yourself healthy and not put yourself in risky COVID situations. So continue to make your fall and winter plans factoring in continued community-wide spread of COVID. And most of all, plan with the idea that we're all in this together.